All right, good afternoon. It's another beautiful Wednesday lunchtime, 12:19 na nga actually. Medyo nandaya ako, nag-early lunch po ako. Hello, Tito Bess. And
Hi,
hello
DJ
to our
Raymond.
viewers.
Yeah, good noon. And good noon to you. And good morning, good evening, good afternoon to
Elsewhere.
our televiewers elsewhere, di ba? Oo.
Yes.
So
At saka sa lahat
medyo
ng manonood on demand, yung
mm,
hindi naka-live. Kasi there are people who watch us on
yes.
demand. So we have
Mm-mm.
another very interesting topic. May nakaka-nosebleed sa simula, yung terminology, yung pangalan ng health issue. Pero this is very common, especially for,
Oo.
mga
Mm-mm.
medyo elderly men like me.
Mm-mm.
Ayan. Okay,
Pero
so
yun
we
na nga yung
oh,
hindi naman natin masabi kung whether the important thing as we always say is knowledge is power. So
yeah,
kailangan you should know about the condition, get the correct diagnosis, 'di ba?
yes,
And then medicate and supplement. Para
yes
naman
po.
we are all healthy, 'di ba?
Yes,
Mas lalo na
preventive lang
ngayon ang
talaga tayo.
daming
Opo.
grabe
Yung
no, ang
COVID, di po
daming
meron din,
COVID.
opo.
You
Pero
have
parang
many
preventive
friends.
yan, measures, yung COVID-19, di po ba?
Oo.
Pwede rin pala
Oo.
yung, kumbaga, kaya nga may mga safety protocols, di po ba? Para lang medyo
Kaya
ma-minimize yung
yeah,
exposure
a group of
natin.
doctors, they are they are advocating yung apat dapat. Although I have to know what
Hmm,
the apat dapat is. But I
okay.
know the apat
Parang may
dapat is,
radio,
di ba?
radio show dati na ganyan, dapat dapat. Medyo sumikat dati yan.
Ah,
Pero mga
mm-mm.
komentary yun, komentary. Pero this one is
Ah.
medical, purely medical.
Ito mga doctors,
Preventive.
I think it is, siguro napagod na din yung mga doktor, no? Kasi, di ba, ang, they're saying na kasi ang nagbibigay ng mga reports are the people from government like the IATF,
Opo.
and then the lawmakers, 'di ba? They
Opo.
and the executive branch are the ones making the mga announcements. But
Mhm.
alam mo, siguro nga kawawa din kasi pag if there's another surge of COVID, ang unang tatamaan are our frontliners. So I
Grabe.
think it's a good thing for them na sila naman ang they came out and they also want to know and to educate the public,
Yeah,
uh,
yeah.
about how to prevent the
Mm.
spread of COVID. And most
Opo.
especially ngayon din na madami na ring vaccines ang pumapasok, people should also be educated on the vaccines. Kasi
Yes, huwag
mahirap din
maniwala
yan
sa
eh.
puro press release. Alam niyo yung problema sa media, press release lang, carry as news. Minsan lang opinion lang ng certain tao, ng certain politician. That's
Mm-mm.
naka-headlines. So whether it's for or against, it's not good. Hindi balance yun. Journalism. So kailangan ilagay, yun ay talagang statement lang. Pero actually, meron naman po programa ng DOH. Nagsasalita naman lagi yung mga doktor. Unfortunately, natin pinapanood kasi nasa PTV4 o kaya sa CNN. Minsan kasi boring talaga. Siguro iba lang nila yung approach dun sa mga yung maiksi. Parang tao din ayaw na ng mahabang mga programa.
Oo.
Gusto
Dapat
maiksi lang.
parang Twitter na tayo. Yun, ano.
Ganyan
Pero sa,
po. Pero
but there are some things.
kaya Twitter po, too short, kaya medyo bored Pilipino, parang kulang. Pero kung
Oo.
sunod-sunod mo yung tweet, okay lang din naman.
Hindi, kasi
Katulong
mahirap
din.
naman sa pag masyadong maikli is you might not
Bitin po.
get the correct information.
Tama.
Ayan, I checked the Facebook page. Mabagal nga lang yung pag-download. Siguro sa dami ng ng nakikinig. It's Healthcare Professionals Alliance Against COVID-19. I think they have a replay na HPAAC Town Hall. Bali, it's like they made it into a town hall. Although Secretary Mon Lopez also did a town hall meeting then yesterday on about the vaccines naman. So, ay, magaling yan
Siguro,
si
may dumating na
Secretary
the
Lopez.
vaccines. Yeah, magaling po
Yes.
si Secretary Lopez.
O, kasi
Kaya,
yan,
from the start, hindi na siya napalitan dahil he's doing a good job.
the difficulty kasi is the balancing of the health and the economic side. Kasi
Yes.
nga, sabi nga nung iba, sabi niyo huwag kami lumabas, paano naman, ano naman kakainin namin, di ba? Sabi ko
Siguro,
nga the government, sabi nila vaccine ng vaccine, dapat yata unang ipamigay nila is the mask, the face mask, kasi yan yung
namimigay
one of the
naman po namimigay po.
konti
Kaya lang
lang
sobrang dami. Ang dami po kasi natin. Ang
correct.
siguro po,
Madami yung but then again, sa totoo lang it's cheaper than the vaccine sa tagal nung vaccine na dumating. Tsaka hindi mo pa alam.
Hindi mo ginagamit yung mask.
Pero hindi mo pa rin alam yung adverse effects. Kaya lang kasi they should be giving the right mask. Kasi sa totoo lang, even yung mask, meron din yung, for example, kung cloth yung mask, tapos wala siyang filter, I don't think it will also do its job as best as it could. And then, tapos kasi nasa shape din yun Napapansin ko kasi ang dami ng mga tao, di ba, linalagay nga dito sa ilalim nung ilong. Di sila yung, if let us for example, they catch some bacteria, nag-stick nga doon sa mask, sinisinghot naman nila, di lalo silang nalagay sa peligro, di ba? Oo. But anyway,
kung merong hindi nakamask, okay makapag-usap ng malapit. Anyway, our topic today,
social distancing, I think it's face shield.
Yes.
Ako na lang gagawa ng apat dapat ko. Face mask, face shield. Diba? Wash your hands. Oo, wash your hands.
Yes.
Kailan parang more than 4 Face mask, face shield, wash your hands, social
distancing. Isa lang po yung face
distancing.
mask, face shield dapat.
Pwede din.
Face mask, face shield. So, wash hands, social distancing, tsaka your immunity.
Boost your immune system, di ba? That's what I always say. Boost your immune system. Kahit kaya nyo yan labanan. Kasi hindi lang naman isang sakit Hindi lang naman COVID Even the hospitals, di ba? 30% ang allocated for COVID. So that means there are still 70% of other illnesses that you may catch. Ayun.
Okay,
so let's go to our guest.
Opo, asayin muna itong comments dito. Tapos we will. Okay, good afternoon, Doc Joseph. So excited for today's episode. Pauline, and also Pauline naman to. Pauline other knowledge about health. All right, thank you guys. And we are going to talk about, may flash ko lang kanito, benign prostatic hyperplasia. Okay, so let's
benign prostatic hyperplasia. Yan.
Okay, American tayo yun. Okay, let's roll VTR. Yung introduction. Yes, here we go. Alright.
Naka-mask pa si Doc Joseph. Hi, Doc Joseph.
Hello,
Kasama yan sa apat dapat. Dapat
yeah,
naka-mask.
oo. Kasi, good noon, DJ Raymond and Tita Bess.
Hello
Okay.
po.
Kasi walang tao ngayon sa
Sige po.
clinic. So, we have to show our viewers that even on the site of the clinic, we have to mask. Pero ngayon, I will have your permission to unmask.
Yes.
Wala
Oo.
nang tao
Kasi-
dito tapos dinisinfect ko. Na may Tita Bess, sabihin nila, naku to si Doktor hindi nagmamas. O yan ha. I'm announcing
Yeah.
it, DJ Raymond. This is lunch break. There is no patient and this has been disinfected, the clinic, and I am the only person here.
Clear niyan.
Well, Doc
Clear
Joseph,
yan,
Doc Joseph, I'm very sure the doctors are taking care of themselves. Alam mo, baka maging endangered species kayo eh. Sa dami ng ng casualty with the COVID. I think
Okay.
that's why last night nga yung I was listening to a it's a Facebook live stream by health professionals association na mabuti na rin that the doctors na ngayon, they are the ones who are coming out and telling the people, this is what you should do. Unlike kasi yung mga tao, puro pasaway eh. Parang feeling nila, dati mga law enforcers, di ba? So parang ayaw nilang sumunod, di ba? Parang, ngayon, nako, sa dami ng nahahawaan, getting COVID and ang masama pa are people who pass away, di ba? I've had friends who pass away this parang medyo mas madami ngayon eh na tsaka yung alam mo yung bigla na lang hindi makahinga, hindi mo tuloy alam whether they are COVID or they just suffered a heart attack. Pero yung isang employee ko kasi yung father niya, ganyan na nangyari. Pero pinatest pa rin, he came out COVID positive. So I think naalala mo yun dati nung unang ng COVID, 'di ba? That's what happened in China. Bumabagsak na lang yung mga tao. And that is what is scary if people are not following the health protocols.
Parang may
Ayan.
iba kasi mga ngayon eh, ibang variants na medyo iba po ng konti yung symptoms. May nabasa akong ganung article. Medyo nagva-vary din ngayon. Iba hindi nawawalan ng sense of smell or taste. Although yun yung talagang kaya akala nila minsan hindi pa siya COVID. Is that true ba, Dr. Joseph? Parang may mga ganyan kasi ako nabasa. Yes po.
I truly agree with what Tita Bess and Raymond you're saying, no? From my personal view kasi, the spike that is happening for the last 4 or 5 days, no? We started at 7,000 and we ended up at yesterday at 5,000, but we accelerated to 8,000.
Yes.
I think this is secondary to a probable, this is me, a second wave caused by variants. Second wave caused by variants, not from the original virus we had 2020, because we have already in place in our country and in our shores 4 existing variants, di ba? We have the B1177, that's the UK variant, and the 351, the African variant. And we have the P01 variant, which is the Brazilian variant. And we have the
Brazilian pa.
I memorized everything. The P03 variant, which is the unclassified or the concerned variant. I think the concerned variant, okay, I think this is the Philippine variant na community acquired. This is me alone, ha? This is not for the show.
Yes.
Kasi tingnan mo, i-announce nila kasi they're looking into the genome na eh. Kasi initially, di ba, Tita Bess and Raymond, they were saying, the variants are just this amount. Ngayon, di ba, the last 2 days, Tita Bess, because sabi niya, it's here. We have the census. We have the number. Parang inantay pa nila yung dami ng
variant.
Sinensus pa.
Can you understand?
Pinadami muna.
Parang Raymond, gusto mo talagang dumami ang number? So this unclassified or yung variant of concern, they call that P03. I think this might be a local mutated variant that is locally for us. Ibig sabihin, this is
Philippine
Philippine
variant.
variant.
Iba
Oo.
talaga, di
It's not
mapapahula yung
UK,
Pilipino
it's
talaga
not,
eh.
yeah, it's not UK, it's not South African, it's not Brazilian, but this is a mutated variant coming
Yes.
from our clusters. We call that clusters, di ba?
Oh.
So, ano ang nakakatakot kasi I was hearing the both of you doing your spills. Kasi this one is naghalo-halo na Tita Beth, DJ Raymond, yung mga variants. So,
Yes.
hindi mo na alam which is transmitting. 'Di ba? Kasi they're all communicable at mabibilis sila. So they,
Yes.
the Brazilian is kind of fast. Also the South African. So which is which now, 'di ba? So it makes us more scarier. Tama ka dyan, Tita Beth. You do not know, suddenly you just might drop dead and cannot breathe. Diba? Yun
Yun,
ang ano.
scary.
Kaya, this is serious. This is serious public health emergency, I think. Kaya,
Yes.
yesterday, I had two of my batchmates who went into intubation sa OSMA. Okay? Biglaan lang. So ngayon, ang takot mo kasi, tama kayo, so suddenly you cannot breathe and suddenly you just have this all body pain coming in, hindi mo alam. Diba? Yun lang ang ano ko.
But Doc Joseph, I learned something this week eh. Kasi we had parang a meeting yung sa women's organization namin. So, yung friend ko, she was telling me, sabi niya, yung when the Chinese doctors, they came to the Philippines, yun during nung first few times nung COVID, there was this Chinese doctor and there was this comatose patient. Alam mo yung Lianhua capsules? What they did, they broke the capsule, yung powder, linagay sa nose, parang addict ka. Kasi nga, hindi ka na makahinga. Comatose, di ba? Ang nagagawa na lang niya is huminga. So, linagay yung powder sa nose. Alam mo, nag-recover the patient.
Okay. Tita Bess, the Lianhua is good, I think, and it's been used in China for really severe and chronic and high risk cases of COVID. It can probably revive the pulmonary function. Alam mo, Raymond, because that is the first system that we heard last year that was attacked by your COVID-19, the respiratory. So pwede niya, Tita Bess, i-revive yun. But that is why they're saying that the Lianhua, you should be careful because you cannot take it for prophylaxis. What do you mean by prophylaxis? Wala kang simptomas, wala kang ano, you cannot just take it.
Yes.
You take it when you feel that everything is like collapsing. Yung anong feeling mo, Tita Beth, Raymond, parang,
yung
parang
hilo ka na.
Oo. Yung ilunok mo yun, parang ano na yan, you will be,
and especially, di ba, Doc, especially when you have fever. When you have fever kasi, mataas na yung fever mo, syempre you need talagang outside help. Kasi when you really have high fever, kasi mahirapan ka eh, if you just do the suob or whatever, you really need kaya lang kasi, di ba there's no hospital, anong gagawin mo? Alam ka, mauupo ka na lang dyan, antay mo na lang na hindi ka makahinga. Syempre, you have to do your first aid, di ba? So, some of the things that you can do is to drink hot liquids. Kasi bakit? Papawisan ka, you will sweat. So when you sweat, the toxins leave your body through your skin. So at least nababawasan yung yung mga toxins sa loob ng katawan. And then like if you drink hot soup, kahit na sabi ko nga lagyan na malunggay soup nga lang eh. that way, you become more nutritious. You build your immune system. Although chicken soup is also works, works for yung sister ko. Basta pag sinabi mo, oh, may sipon, oh, chicken soup. Kasi it works for her. Kasi food is your medicine eh. Kaya alam mo din dapat yung kailangan mong gawin, 'di ba? To help you boost your
Yeah.
immune system.
Tita Ben, sa amin kasi sa house namin, sa bahay, my mom has a planter of lemongrass, like what is
Hmm.
contained in your gusto
Hmm.
juice. Meron siyang
Hmm.
lemongrass,
Mm.
DJ Raymond. So, pag
Mm.
feeling niya, medyo you've eaten something that is a bit hot. Aywan ko, yung sa Chinese
Mm.
kasi tawag niyo, Tita Ben, diet? Yeah,
That
diet. I
no.
do not know
Kasi in
in
I always translate it also to hot kasi it's easier to understand eh, 'di ba?
Mhm.
Kasi
Ay, yung
yung
hot as in
oo.
chili hot, red hot, chili pepper, gano'n?
yung
O yung
hot
hot
kasi
temperature?
Raymond, kasi yung hot kasi
It's
ibig sabihin yung
heaty eh.
oo,
Actually
parang
heaty.
oo,
The
parang
more appropriate term is heaty.
you eaten
Heaty.
something that is a bit heavy and it makes your body temperature a bit high. Oo, yun
Okay.
yung ibig sabihin. Example
Okay.
di ba Tita Beth, like if you eat a lot of vegetable, that is not a hot food, no? It's a very
Mm.
light food.
Mm.
Ang ibig
Mm.
sabihin hot food, Raymond, kumain ka ng, let's say, a lot of meat, then
Mm.
Uh-huh.
kumain ka ng chocolate, di ba?
Acid.
Nagsama-sama yung mga hot
Mm.
items, yung gano'n. So,
Okay. So
parang
heavy na
feeling mo
siya.
ang gat ng katawan mo.
Oo,
So,
heavy.
yun. So, when
Mm.
you take in like lemongrass or ginger, you put ginger,
Mm.
it lightens and it cleanses and detoxifies, di ba?
Detoxifies yan.
Mm.
Sa
By the way,
segue ako, that is the
lemongrass
ingredients
is
in gusto.
Opo.
Hindi, totoo yun.
Pero
Totoo yun.
marami pong
Kasama
laman.
No.
10 ata yun, 10 yung
ah,
gusto, 10. Di ba ba,
Then you can
tanlad
put
yun,
it,
tanlad ano? Lemongrass is
oo,
tanlad.
oo, kasi
Ayan.
ako
Tanlad,
kasi,
okay.
like, me kasi Raymond, Tita Beth, when I go home, minsan sasabihin ng mom ko kasi, sabi, sige, mag-inom ka ng soup. Sabi ni Tita Beth, soup. Ano yung
Mm.
nilagay mo sa soup? Lemongrass and chicken sa tinola. Pero
Mm.
may lemongrass, Raymond. I do not know how.
Mm.
Okay yun.
I don't cook. So sabi niya,
Mm.
inumin mo yan. If you do
Correct.
not like the chicken, you just drink the soup.
Yes.
Because
Oo.
andoon daw yung sustansya ng
Nutrients.
lemongrass
Yes.
and what if, yeah,
Even the
that's it.
chicken, yung nutrients of the chicken. Sa,
Exactly.
sa yung kinukuwento ko nga yun sa Hong Kong, 'di ba? What they do is all this nutritious the chicken, the meat and everything, they let it go on slow boil. Tapos painumin sa yung soup lang.
Mm.
Yung mga meat, wag mo nang kainin. Pwede mo nang hindi kainin because all the nutrients are there.
Oh, in the
Ayun.
broth na siya, in the broth. Meron ba dito ang
Oo.
tinatanong kay
Ayan.
Doc si Colleen? What can you say to those people who always do
Ay.
self-diagnosis instead of seeking for professional help? Yan, guilty ang mga Pilipino. Maraming Pilipinong ganyan.
Give them
Eh,
Can't blame
scolding.
us.
give
Give
them
them
scolding.
scolding.
Oh, dangerous eh.
Give them scolding.
Kasi parang takot
Dangerous.
kasi gumastos po ang karamihan ng Pilipino dahil sabi nga nila, nako, mahirap na hospital. Diba? Medyo para doon para doon taxi yan eh. Yung
Kaya
metro,
lang,
mapatak araw-araw.
pero kaya nga, if you don't want to get sick,
Kaya
you
daw
have to
preventive.
prevent. You have to
Yes.
prevent getting sick. That's why you have to do your
Yes.
you have to have a good lifestyle. You have to
Mhm.
supplement. You have to take
Balance, ano?
care of the food you
Yes.
eat and everything, 'di ba? Mahirap magkasakit, mas mahal
Yes.
magkasakit. And then
Yes.
also, pag if you abuse your body, 'di ba remember I don't know if one day I should be able to, make a video out of it na, for example, you are here in the center at this point. Ito yung papuntang healthy. The other one is papuntang unhealthy. Kung ano-ano yung masama. Imagine niyo na lang, 'di ba? How will you go back to being healthy? 'Di ba doble? Triple pa nga eh. Kasi ang nagastos mo papuntang ganito and then pag ganyan pa. 'Di ba triple ang gastos mo? So, if you are thinking that being healthy is expensive, then you are not then that is something we have to think hard
Wrong,
about. I
opo,
don't
wrong
think it is
priorities.
correct. Oo, right. Oo.
Tama-tama, exactly what ito pasok dun sa ating topic kasi we're here to know how to help prevent din itong sakit na ito
Mm.
eh. This is kinda nosebleed ang terminology nito ha. Pero
Hindi
ito,
naman. Oo, yan.
benign prostatic hyperplasia.
Plasia. Okay. So
Plasia.
we will para hindi Tita Benz ma-toxic si Raymond. Okay. So this is it. When you say benign, that is a pathological term. When you say pathological, what is the consistency of the cell? So pag sinabing benign, so it's not cancerous. So
Opo.
check ka, ma-happy ka kasi it's not cancerous. Prostatic comes from the word prostate gland. So because it's the cell of the prostate. So prostatic.
Okay.
Kasi pinag-uusapan natin ang prostate, di ba? Then
So this is present lang sa lalaki, sir. Doc,
Oh,
pang lalaki na
yes.
naman ito.
Oh, pag meron sa babae yan, you should wonder what is the gender identity of it. Di ba? Bakit
OMG.
meron ka niya, babae ka? O ano ka ba,
Okay.
transgender or hermaphrodite? So, hindi, ano yun. No, hyperplasia, Raymond at Tita Beth, is increase in the number of cells. Increase in the
Ay,
number of cells.
di ba
Okay?
positive yun? Parang dumadami yung cells
No,
mo.
hindi.
Nag-rebuild. I mean, nag-regenerate.
Hindi. Ano to, iba naman ibig sabihin, dahil dumadami ang cells mo, lumalaki ang prostate mo, then later on, it will cause problem of obstruction. Magbabara ngayon ang ihi mo kasi lumalaki ang prostate mo.
Lumiliit yung
It's becoming big and it is
Okay.
obstructing the passage of your urine that is initially reserved in the urinary bladder and it cannot pass out freely sa urethra. Okay.
So Doc
So
Joseph,
that is
the layman's term for benign prostatic hyperplasia is enlarged prostate. Tama. Tama
exactly.
ba ako?
Tawag
Okay.
nila pamamaga ng prostata o
Okay.
swollen prostate. Yan.
Ito yung this can lead to prostate cancer if this is not corrected. Parang ganun.
No.
Not
That
really.
is
Okay.
a wrong
Good news pa
notion.
yun. Good news.
Okay, kasi sabi ko kanina, DJ Raymond, you have already the prefix of benign. That's benign.
Oh, yes.
Okay?
Tama pala, benign.
So that's not
Hindi siya,
cancerous. Now,
malignant. Pagka-cancerous,
Oo.
malignant. Di po ba?
yeah, that is a question that is commonly asked by some of our viewers and some of our patients. They say, Dok, pag benign siya, pwede ba in the future maging cancerous? You're right in asking that, Raymond. Now, that will happen in case there is change in the type of cell. So, ibig sabihin, Tita Beth, yung cell mo na normal, magiging abnormal. It becomes dysplastic. The term, this is another tongue twister na term. Dysplastic, D-Y-S. Dysplastic, ibig sabihin, the cells become distorted. This is not normal. Okay?
Oo nga. Parang yung pag sa breast cancer, di ba? When the cyst, when they have, may certain shape kasi that will say na it is cancerous and there are, di ba? The doctors will know by the shape sometimes whether it is cancerous or not. So, pero what are the chances ba of a benign prostate becoming malignant?
Okay. You have to look into other diagnostic parameters like your PSA, no? Your PSA is your blood exam. You term it as prostate-specific antigen, di ba, Raymond? You do that. You have to do that when you're 50 years old and above annually to check. Now, if the units or the numbers are more than 10, then if you have a big prostate, there is a percentage probability that it might be malignant in nature. I am not saying it is already malignant, because the only way that you will have a definite diagnostic pathological, ibig sabihin pathological, with tissue confirmation. Pag sinabing tissue confirmation, Tita Beth and Raymond, ibig sabihin na biopsy mo. You cannot tell a
May
patient
laboratory na.
straightforward and tell you, Raymond, hoy, may cancer ka, manghula ka ba? Wala kang biopsy. Oo.
Oo.
And cancer is a strong word that can stigmatize you and can be
Correct.
a depression later on, di ba?
Mm.
Di ba isa sasabihin, Raymond, Tita Beth, sabi ng doktor, may cancer ako eh. May tanning na ako eh. I have to live this life. And
Death
who
kasi yan.
said so? Do you have a
Connect sa
biopsy
death yan
result
eh.
to do you have a biopsy result to confirm? So
Yeah.
it has to be confirmed. Once everything is confirmed, then is the time you can label it as prostate cancer. Now, with going back to your question, now if you have a genetic predisposition to having prostate cancer and you have all the risks, Tita Bess, you have all the risks. Ibig sabihin, you abuse yourself, smoking, drinking, everything, you're eating, everything. Tapos, chemical exposure, genetic, you might convert your benign prostate into cancerous in form.
Okay. Pero siguro let's talk about the benign kasi morbid na nga yung COVID eh. Morbid ka
Next time na yun, prostate cancer.
Oo, next time
Question
na
lang po,
today.
tungkol sa statistics niyan. Ilan bang sa men? Ano ba statistics niyan for elderly men? Ito mga ganitong.
Okay, what's nice about it, Raymond, kasi when you reach 50 or 60 and above, you get a batting average of 80 to 90% that you might have enlarged prostate. But you can have enlarged prostate, you have to have the symptoms. You have to grade the symptoms. Meron iba kasi malaki ang prostate pero walang simptomas.
Okay.
Good for you. Ibig sabihin, you're not feeling anything. But you have a big prostate. So wag mo nang pakialaman kasi there is no comparison. That's the problem with our patient. And when men start comparing one prostate to another, uy, nagpa-opera ako, pa-opera mo na rin yung prostate. Wala naman akong simptomas, wag mo nang pakialaman ng prostate ng kaibigan mo. If you do not have symptoms, malaki ang prostate mo, just leave it there and observe. Now, what is problematic, Raymond, Tita Beth, is if you have a big prostate and you have symptoms. Ano ba yung symptoms? Difficulty of urination, patak ang ihi mo, you wake up early in the morning, tapos you feel that there is urine in your bladder, parang retention, yan. Tapos yung ihi mo, parang intermittent, there is strong and short, there is strong and short. Then that is a time you have to worry because that is not normal.
So bale, when it's so, I'm happy to note na if your prostate is enlarged, hindi naman lahat kailangan uminom na ng gamot or what, kasi parang it's part of the process of growing mature, di ba?
Normal lang po, normal. Pag tumatanda na, kumbaga.
Oo. Pero
it's okay.
Oo.
I just turned 60 yung Sunday.
You don't look like...
happy birthday, Raymond!
Happy birthday, Sir Raymond. You don't look like 60.
Dual citizen ako.
Oo, masaya yan. May senior citizen card, diba?
Kuka pa na ID. So, pero yun na nga, pag sabi kasi dati ng doktor, baka medyo enlarged yung prostate, parang ganun siya eh. Medyo medyo enlarged. Siyempre yung lalaki, medyo yung patient, will be a bit, diba, anxious or scared. It's good to know that hindi naman pala necessarily, cancerous na kagad.
This is the thing, DJ Raymond at Tita Beth. Sometimes kasi our ultrasonologists are so, becoming internists or specialists. Alam mo, they go beyond the clinical. Kasi sila procedural. When you say procedural, you just do the ultrasound. Ang problema kasi, Tita Beth, minsan kasi, they do not know the history. They start, mumbling things to their patient. Ako, experience ko
Mm.
yun. I have a lot of ultrasonologist friends. They're my friends. But sometimes kasi mga technician starts mumbling. What is TJ
Yeah.
Raymond mumbling? Oy, sir, parang may nakita ako malaki, nakakatakot.
Oh,
Who are
yun,
you
no?
to say? You're not even a doctor. So
Yeah.
ngayon, yung pasyente, kagaya sinasabi ni DJ Raymond,
Mm.
natatakot. Ay, ganun ba?
Natakot.
Malaki ang prostate ko. What
Mm.
is nice is when you have that finding, you go to a specialist or a doctor to explain to you.
Yun.
Kasi yung mga technician, they just look at it on the basis of what is diagnosed. They do not know your history. You get me? Pag walang history, hindi mo pwedeng i-manage yan outright, di ba? They're
Tsaka
just going to...
Tsaka
Oo.
Doc Joseph,
History
'di
mo.
ba, there are also blood tests to confirm the findings of an enlarged prostate. Kumbaga hindi lang naman dahil sa enlarged yung prostate mo, then you have to be concerned already, 'di ba? Like you said, hindi naman kung minsan pwede na mahayaan lang siya. But then
Mm.
you still have to be under the guidance of a urologist.
Yeah.
What
'Di ba?
we what we do kasi Tita Beth, Raymond, is like when you say non-medication or non-surgical intervention, we just observe is when you do not have symptoms but you have a bit of enlargement. Kasi may malaki ang prostate mo pero wala kang simptomas. There's no symptom. Ibig sabihin, everything is clear. We did the history. Wala ka namang problema. You're not urinating more than what we expect. So what will be the advice of the doctor is every time that when you have a change in your urination, you have to come and see us and follow up and do annual examination. Yun ang advice namin. So we do not give prophylactic medication just right and left.
Oo.
Kailangan may basis muna.
Kasi nga merong
Based
blood
on
test.
science.
Pero yung Doc Joseph, 'di ba yung PSA is I know it's parang used to be 4. So if it's more than 4,
4.
we have to be concerned, 'di ba? Some
Yeah.
people they
If it's
take
more than 10.
medicine
If it's more than 10.
more than 10, yun medyo delikado na yun. Medyo baka malignant na. But as you've said nga, even if it's 10, it may not be malignant, 'di ba?
It may
So
not be, correct ka, it may not be malignant unless you do a biopsy. You have to do a biopsy. Kasi pwedeng infection lang yan eh. Infection can increase your PSA, Raymond. Prostatitis. I think we discussed it before. Prostatitis.
Yeah. So that's why nga yung mga males sometimes, hindi lang women ang may UTI, 'di ba? So parang yung mga men din,
Iba lang pong issue.
Blame it
Nung
to,
una,
ano yan eh, tawag Raymond, blame it to the men.
ayun. So, yun na nga, the symptom, one of the yung madaling ma-diagnose na symptom is the volume of the urine, di ba?
Exactly.
Right.
So,
But
when you say volume, yung parang konti na, yung intermittent,
No.
tapos you having difficulty.
Raymond, what we measure pag nag-ultrasound, like ako, I'm really concerned kasi may ibang mga ultrasound natin, they don't put the complete, is the post-void. Diba? If you had that experience na yung sasabihin ng technician sa iyo, oh ma'am, sir, no? Kunya si ma'am, kahit na sa babae pag mga bladder when you have your inom kayo ng inom ng tubig kasi they will fill up the bladder for you. That is non-physiological. Ibig sabihin, ginagawa mo yan in order to do a procedure. So once your bladder is full, i-ultrasound ka nila. Pag nakuha na nila yung maximum volume ng bladder mo, yung distension, then they will ask you, Sir Raymond, pag umihi ka na, balik ka dito, ultrasound ka namin ulit. Yun, Tita Bess, yung naiiwan na ihi, that is very significant because if you have, this is for our audience, if you have more than 30 ml that is still remaining, that is already retention. You have a problem. So
Mm.
more than
Mm.
30 ml, like say 60. So meron kang additional
Mm.
30. So yung 30 doon, hindi dapat nandoon. Kailangan
Mm.
iniihi
Mm.
mo yun.
Mm.
So, ibig sabihin, there's something, kasi if yung the urine stays there when it is not supposed to be there, yung the more than that volume, parang like sa colon, if you let the meat uh,
Stay.
stay there for a longer time, then there's a
Yeah,
tendency to have more bacteria, di ba? The bad
exactly.
bacteria. So in the
Exactly.
same way, ito din, parang yung the urine, they stagnate there for more
Exactly.
than it should be, then it might become something not good, di ba?
It becomes a
Okay.
a nidus or
Parang,
a reservoir for
uh,
bacterial infection.
Tsaka 'di ba yung sometimes when the urine stays in your body for a long time, parang how do you call it? 'Di ba mapanghi when you remove it pag when you urinate. So that means it has stayed
Mm. Ayun.
more than
Ito
the
yung
time that
yellowish.
it should be there.
Yan. Di ba?
Oo.
Exactly.
Matagal kayong hindi
Oh, how
nakapink.
about the color of the urine,
Color.
Doc
Ayun.
Joseph? Is there
Now,
color to what
when
the
Connection.
you talk
urine?
about sa BPH naman, sa benign prostatic, we don't usually look into the color, but we look into the volume. But if you're considering the
Mm,
color,
mm,
sometimes if the volume of the urine that is passed out is very small in amount, you get a much concentrated color. So medyo darken
mm.
yung
Dark ka
yellow
na
niya.
yellow.
Yeah, dark
Mhm.
yellow. Yeah.
How about yung I remember one time there was yung orange. If your urine is orangey in color.
Orangey
Ah,
color could mean food intake, food
mm,
intake, or other diseases than the
mm,
bladder. You have to take
mhm.
a look at the liver kasi papunta na siya sa
Oh,
liver pathology, no? So you have to
Mm.
check the liver also.
mhm. Hmm. Kaya nga yung system natin, it's always
Interconnected.
yes, oo.
Yes.
So, sometimes feeling natin, ito, tapos pinabayaan, kunyari, you have an enlarged prostate, pinabayaan mo, sometimes it affects the other organs of the body, di ba?
Mhm, mhm. In the beginning kasi we do not have this eh. Alam mo,
Mm,
Raymond, like if our ancestors in the north or upper highlands, they don't really mind and doing this, telling themselves na, oh, ang laki ng prostate ko, kagaya nga sabi ni Tita Bess, siguro in other countries, this is a normal aging development, di ba? So
mm,
pag
mm,
nahirapan kang umihi, matanda ka na, ganyan, di ba, Tita Beth? So,
mm,
it's a part of and part. But now kasi, we are scientifically,
mm,
complex.
Aware.
So, yung pagganyan, so ibig sabihin, may problema. Ginagawa
mm,
natin
mm.
ang problema.
Oh,
Ah,
Kaya may
they,
mga
dis-
specialista
they
kagaya
discover na.
namin.
Yeah.
mm. Yun na nga, kaya nga, huwag nga matakot kasi we always say, if you have a problem, then let's solve it. There's always a solution to a problem, di ba? And for all you know, it's not a problem after all, right?
Hmm. Hmm.
So, but yung pagganyan, aside from the volume, mm, wala nang ibang kailangan tignan.
I'm very I like to see the size and the gram and
Mm,
how big is the prostate, no.
mhm,
Usually kasi the best Raymond, the prostate, you given a 30 grammers, okay yan. But beyond that, then you can probably say that, oh, your prostate might be big. Oh, di ba?
mhm,
Paano pag na-ultrasound ka, lumabas yung prostate size mo, 50 grams. So that's 20
mhm,
grams exist. That's big.
Mm.
Diba?
mm,
When you try to look into the history, try to dig into the history of the patient, he might have starting symptoms of prostatism or yung LUTS, lower urinary symptom. Sinasabi
mhm,
natin, yung difficulty of urination, small volume, less on caliber, retention, all those stuff, then you try to look into the possibility of how do we manage your patient by medical, surgical, or non-surgical. Yung non-surgical or you use the endoscopic, di ba?
May laparoscopic na ba na surgery to the prostate?
We use a lot of endoscopic, meaning Tita Best, laser, resection, microwave thermotherapy. Now, if you use laparoscopic, you have the intention of removing the prostate to the abdomen. These are prostate that have reached like 80 to 100 grams. So, mahirap kasi pag in-endoscopic mo, Raymond, aabutin ka ng siyam-siyam sa kakakayod, di ba? That's 80 grams, di ba? How long will you resect that? So ngayon, the best way, if you have prostate as big as 80 to 100 grams, bubuksan mo siya. Diyan papasok yung conventional open, which is surgical, or laparoscopic.
Laparoscopic, Raymond, is yung 3 butas lang. That's the modern method para lesser infection. 3 butas.
Tita Bess, ganun na nga yun eh. The innovation is so fast. We went from 3 to 2 ports.
2 holes
ngayon,
na?
Isang port na lang.
Isa na lang? Oh, that's very good. Pero yun na nga, people should, pero what are the chances na, like if you have an enlarged prostate, kasi I remember yung father-in-law ko before has this problem na enlarged yung prostate, hindi naman siya, well, I don't think, well, he had his TURP ba tawag doon yung pagkayod. One time,
resection of the prostate.
But I think hindi naman siya malignant. So we let it be, pero syempre nung medyo mas nagkaedad na, ang nangyari is yung dumagan, nakadagan sa bladder ba yon? In such a way that
lumaki siya, tita. Ibig sabihin, lumaki pa siya? Oo.
Lumaki siya. So he had a suprapubic catheter.
Pero na-resect na siya eh. Sabi mo, natanggal na eh.
Na-resect. Di naman nakayod. Pero I don't know, siguro bumabalik, di ba? It doesn't mean naman that if you have one TURP, you will not have a second one. Tsaka matagal na yun eh. Siguro before, well, technology might not be that advanced, di ba? I would assume ngayon, if like for example, if you use laser or something, siguro naman mas matagal yung effect ng procedure before it becomes enlarged again.
Ayun, tama ka dyan, no, Tita Bess, DJ Raymond. Even if you do resection, you do not resect everything. So you leave a small tissue of your prostate. So when you leave a small piece of your prostate along the capsule area, you have to remember these are live tissue. So they have the possibility to engage or start to increase in time, in due time. So you might ask your doctor, Doc, na-opera na ako 5 years ago, 10 years ago, ba't lumaki na naman ang prostate? Yun ang natin. If you are genetically really prone to increase the size of your prostate, kahit na na-resect yan, lalaki pa rin yan. In the next few years. Ngayon, ang tanong nyo, bakit pa nagpa-resect?
Parang ay, Doc, meron ko tayong mga questions, pero we will take a break muna. Colleen, mamaya, pagbalik natin, actually, she has 3 questions. Wow. Okay, sige, let's take a quick break. Don't go away, guys, and we'll be back with more of Doc Joseph Lee.
Ikaw ba ay may problema dahil sa bad bacteria? Mayroong solusyon para sa'yo, huwag mag-alala. Subukan mo na para may good digestion ka. Happy life sa Team Biota. Team Biota, para laging mas happy ako dyan.
Mahalagang paalala, ang 15-biota ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Kung puso ang problema, break the bad habits. Move on na para sa healthy heart. It's a big 5-0. Tara na, let's all be fit. Mega healthy sa Omega 963. Para sa heart nutrient deficiency. Sa big 5-0, strong ang heart and body. Sa big 5-0.
Nakamove on ka na't kumanda? Sa Big 5-0, puso mo ay alagang-alaga.
Mahalagang paalala, ang Big 5 o ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Anak, anong gusto mong juice?
Ang gusto ko, veggie juice kasi gusto juice, gusto ng lahat. Ang veggie juice na papasigla ng katawan. Nasa gusto na ang lahat. May gulay na, may prutas pa. Ito na ang sustansya. Vitamin ay kumpleto. Ikaw ma, gusto mo?
Uminom na ng isang baso ng sustansya. Kompletong sigla para sa ating pamilya. Gusto veggie juice, your yummy veggie drink.
Mahalagang paalala, ang gusto ay hindi gamot at hindi dapat gamitin panggamot sa anumang uri ng sakit.
Hi, Doc Joseph. I have an interesting question. Baka
Sige, ma'am.
nahiya si Raymond magtanong. Ako na lang ang magtatanong. A lot of people think that if you have an enlarged prostate, it affects the ability to perform the sexual act. And I don't know then how true, sabi nila. So you have to practice sexually so that your prostate doesn't naman get enlarged.
Ano ba yan? Myth or fact?
Hindi, kaya nga ikaw ang tinatanong ko, Doc Joseph.
Hindi, ano
We
yun?
don't...
Tanong kasi myth or fact? Is it a myth or a fact? Okay.
Mhm.
Now, oversex and undersex doesn't have any bearing of whatsoever, no? With regards to enlargement, regards to reduction of the prostate, no? Now, it might have the use if you do expulsion of your semen is you increase the productivity of your spermatogenesis. That could be a good indicator. Now, if you have BPH, it doesn't have any bearing or it doesn't have any alignment with what we call erection or libido. You have to remember libido is hormonal, no? So it comes from your other system, diba? So especially when you have mentally aroused, then you start to have your libido coming up. Then you have your erection. So erection is mechanical. Okay. Now they do that and they correlate that, Tita Beth Raymond, because the male organ is very near the prostate. So parang feeling nila, because of their close proximity, baka affected rin. No. So when you have a BPH, that's BPH solely lang. Now, I think when you start drinking some medication, baka ma-affect yung erection. That is the point. Yun naman ang ano natin. There are some medication for the prostate that might affect your erection and libido.
I see. So, mga guys, narinig nyo, hindi nyo kailangan daw mag-practice. Baka mamaya ma-infection pa kayo. Draymond, what questions daw do you have?
Sorry po, kasi may Senate hearing kasi. Ayan. Anyway, nag-chat kasi bigla po. Ito, what can you say to the people who, hindi pala. Ito
And
pala.
always do,
How to avoid the occurrence of such condition daw po. Yeah, thanks.
All right.
Yeah.
So to
preventive.
avoid, I think DJ Raymond, she's a she. She's asking regarding BPH, how to avoid.
Yes.
If it's genetic and it's hereditary, you cannot avoid kasi it will continue to grow. You can avoid its complication and its severity by doing examination and having yourself checked from any health
Mm,
provider or ayaw mo specialista kagaya namin kasi sabi mo, ay baka mahal ang consultation, at least makikita ka, at least your prostate will be checked, at least the status of the condition of your prostate gland will be evaluated. Then,
mm,
once it is served to you and say, walang problema, and that is how you take and preserve your prostate. O okay pala yung prostate ko di ba? That's how you
mm,
take care, no? That is how you prevent it. And hindi yung
mm,
parang after may nararamdaman ka na, DJ Raymond,
mm, mm,
okay lang yan. It's part of aging. Nako, hindi
mm,
na uso ngayon lahat part of aging. You have to check which part
mm,
are good and which
mm,
part are not. Oh,
mm.
Mhm.
Siguro ano yan, Doc Joseph, while you are young, you check it maybe once in every 5 years siguro. But as you get older, and then if there's a chance or there's a probability that it gets enlarged, then you have to check more often. I think that
yes,
is the best
exactly.
preventive, no?
Exactly, exactly.
Mm-mm. Mm-mm.
Especially
Don't
when
pick
you are 50
because
years old and above na, you
yeah,
have to
oh,
get
Mm-mm.
yeah, because
prostate evaluation.
doctors should be our best friends, di ba? They're not our
Mm-mm.
enemies.
Mm. Oo nga,
Yes. Ito,
kaya,
alam mo,
kaya
yeah,
Raymond, best friend mo si Doc Joseph, no?
Of course, we're friends.
double thumbs up yan.
Yes.
Tama-tama,
Double.
nag-senior na ako.
Mm.
Ito, may question si Charlotte pala to.
Mm.
Dr. Joseph, what can you advise for men who have this kind of condition but are scared to speak up or raise their
Mm.
concern? Eh kasi most
Oh,
men are really parang medyo ayaw magsalita, di ba? Medyo,
yeah,
Di
I
ba?
just
think
keeps
this
it to
is
themselves, ganyan. Not open
Ako
to these kinds of things.
DJ Raymond, chismoso kaya mga lalaki.
Sa ibang aspect po. Sa ibang aspect, showbiz o sa mga politics, ganyan. Pero pagdating sa mga personal na
Mga
ganito,
sakit-sakit.
medyo,
Pero
mas
parang
sis-
feeling ko,
mas chismoso ba? Tita Beth, mas chismoso mga
feeling
lalaki.
ko, kasi the women, we are busy all day morning till night sa totoo lang. So, kaya siguro they feel na chismosa yung babae, they say. Kasi nga, when we have the free time, then we talk a lot, di ba? Pero, ang problem is, we have less free time. Pero yung mga males, they have more free time. So, when they have more free time, there's a tendency for them to talk more. Yan yung na-observe ko. Maybe in olden times. Kasi in olden times, pero hindi din when you have to do a lot of housework, hindi din I don't know, maybe the women lang are more detailed. Ganon. Parang kunyari, if there's one topic, lahat usisain lahat to the last detail. Pero yung men, kasi di ba, more more general. So, kunyari, they go from one topic to the other,
Hindi,
probably. Siguro
and
yun.
I like, and this is like an insert, DJ Raymond. You can contradict me
yes,
on
yes.
that. I like to ask Tita Beth, who
Hmm.
is more, kung sinabi niya mas chismoso mga lalaki, who is more detailed in the chismis? The
Ay,
female or the
babae.
man? Kasi
The
when you say
female.
more detailed, kasi pag sinabi mo, baka lalaki, parang, di ba, uy, Raymond, si ganun, kasama si ganun. Ganun? O, tapos si Raymond,
Tapos
Wala
na,
na.
di ba?
go to another.
Mas tapos na
Pero
usapan.
minsan kasi,
Eh,
pag babae kasi, baka mas detailed sila kung
Lahat
ano
na,
talagang
detalye na, pati
kompleto.
age, pati...
pati suot na damit, pati, di ba,
Oo.
kung saan
Alam mo,
nakita.
Yes, oo. Mas
And
complete yung
actually po,
story.
yes,
Complete yung
yes.
story.
Yeah,
That's
actually
why
pag,
people feel
opo.
na chismosa yung babae. But I think,
At saka yung paglasing lang naman madaldal. Ang mga men po, paglasing
hindi
lang
na...
sa inuman lang sila. After ng
Pero,
kwentong
correct,
inuman, wala
correct.
na eh.
pero yung iba, hindi. Yung iba, pag nalasing, tulog. But you're
Bago
correct
makatulog yun,
there.
marami mo ng kwento yun.
Oo. Madaming tama. Siguro, madaming yung hindi
Nakawento po.
hindi hindi nasasabi
Actually,
when they are
po kaya,
not
sabi nga kasi mga mga Pilipino raw, mas Kaya marami na mahilig uminom kasi marami masyadong introvert or masyadong hindi
Oo.
makapagsalita.
Mhm.
Pag di
Hindi.
ba, iba nga, di makaligaw na hindi nakainom, di ba?
Yes,
Tapos, a long
yes,
time ago, I
yes.
don't know. I don't know ngayon mga teens ngayon. Pero dati
It,
ganun yan.
kasi when
Kailangan
they have a
maglalasing pa.
bit, when they have a bit of the alcohol in their system, their being introvert becomes extrovert now. O, so they tend to be
Yes, yes.
talking because
Yan.
when
Spoken na.
when
Yan.
they're not alcoholic, they're not in alcohol, medyo tangtay, hindi makasalita. Unless you are already an extrovert na kagaya ni Raymond na nakakasalita
Oh,
ka,
yes.
dire-diretso.
Raymond,
Then,
Raymond kasi DJ di ba?
so
Oh,
diretso yan,
communications
diretso.
major eh.
Hmm.
Mm-mm.
Pero hindi,
But
nung
I
ako
was
sa teenager, tahimik din ako. Tahimik din po
But
ako
I
dati.
was just telling nga yung staff ko nga today, si May. Sabi ko nga sa kanya, ang problema nga sa mga bata ngayon, they type and type. They do not want to talk. Sabi ko nga, emergency na,
Ay.
hindi pa tumatawag sa telepono, naka-Viber pa. Sabi ko, eh, paano na yan pag hindi ko nabasa yung Viber, di ba? So, and
Oh yes,
the
call lang kayo.
more you talk,
Free.
practice yun eh.
Yeah.
The more you talk, and I think the wisdom there is when you talk, immediately kasi kailangan yung mind mo nagpa-function so that you will say the correct words. Unlike pag when you type, nakakapag-isip ka pa mas mabagal. So,
Napag-correct pa.
and
Napag-correct.
oo, pwede ka pa mag-correct. So, it's actually a way of helping you with making your mind think faster and helping you also to talk a lot, 'di ba? So, kung ayaw ninyong mag-Alzheimer's, 'yun, mag-talk na kayo. Mag-umpisa ng magsalita. Baka mamaya medyo nakakalimutan. Uy, totoo 'yan kasi me sometimes I find difficulty in finding words na rin
Si
naku, baka
ma'am.
mag-Alzheimer's na ako. Yeah.
Tama po
Anyway,
yun. Anyway, it's
ah
1:20 na po. Baka si Doc may kasunod na
ay!
surgery. Yan.
Last question.
Ito po,
Nako,
meron lang
magpahabol tayo.
para natin. Ano lang po ito. Sige, masarap pakwentuhan
Kulang
si
ang
Doc.
1 hour, kailan
Jokes.
2 hours, kailan may part 2.
Oo.
Bale po, dapat pala mag-webinar. Round table tayo. Round table talk. Ayan. Kaya may question po ito. Parang take away na rin natin. Inspirational words for those people who are currently fighting this kind of battle.
Inspirational word, always find time to have yourself checked. The minute you have even the mildest symptoms or the change in your urination, okay? Babalisaw-saw, nahirapan umi, the volume have changed, you have frequency in urination. Try to find time to have yourself basically have check, no? If you're scared of doctors, you can do laboratory examination. Anyway, kasi doctors will prescribe the laboratory, no? But you can do the basic ultrasound kasi pwede naman yan. You go to a diagnostic center. Then try to find out, no? It's nice to do it as early before it becomes too late and you have problems beyond not beyond what you can expect, no, like difficulty of urination, then an indwelling catheter has to be placed for you to urinate, mahirap yun, no, or even surgery kasi if surgery has been contemplated when you go for consultation, baga sabihin mo sana hindi nangyari yan if you had early evaluation. Yun lang.
Thank you very much, Doc Joseph, for those
Thank you,
words of
DJ
wisdom.
Raymond, Tita Bes.
Oo.
Ito kasi
Para yung
medyo,
mga
paano pabayaan to, major talaga to, major problem to. So, kailangan talaga maging preventive tayo.
Oo. Ayan. So, we hope to see you again, Doc Joseph.
Yeah, of course. Invite me as
Yes,
often.
Doc, may TikTok ka na nga ba, di ba? Parang may TikTok.
Wala akong TikTok.
Wala pa ba? Binlog mo lang sa YouTube mo yung TikTok. No?
Oo.
Kasi minsan pinapollow ko si
meron
celebrity
na.
Doc.
Meron ng
Hindi,
TikTok
isa
si
lang
Doc
beses.
Sa
Joseph.
YouTube. Sa YouTube.
Isang beses lang ako nag-TikTok with Regine Tolentino.
Okay. Wow,
O,
talaga Doc, celebrity.
dapat pala yan yung papakita natin next time, DJ
Oh my God.
Hindi,
Raymond.
kaya ako natanong, Doc, we'll get in touch with you baka meron tayong
Right.
pwede tayong
You
mag-TikTok
know,
and demo.
our doctors are also human beings. Kaya nga sabi ko nga, yung mga may COVID dyan, nako, alagaan natin mga doktor natin. Huwag
Yes,
niyong hawaan.
hindi, tsaka huwag kayo magpasaway, di ba? Ayan. Sige, Doc,
Sige,
thank you so
thank
much
you
po.
very much. Bye-bye. See you
Sorry na
again.
overtime tayo. Okay. Magproblema tayo ng video natin before we wrap up with Tita.
Our video takeaway.
Yeah.
What happens when you drink hot water every day? We all have our morning habits, how we start the day and what we do first after we get out of bed. Some drink a cup of tea, some a cup of coffee, some first eat breakfast and others just leave the house leaving these things for work. If you drink warm a glass of warm or hot water on an empty stomach every day, then it will increase your digestion, improve your metabolism and help your body eliminate toxins. Here are some of the biggest advantages of drinking hot water every day that will convince you to start doing it too. Health benefits of drinking hot water. 1. Detoxifies your body. Drinking a glass of hot water every morning will help your body eliminate all the harmful toxins we store as a result of our unhealthy lifestyle. Water promotes the breakdown of food in the stomach and improves the function of the digestive tract. Instead of drinking a glass of cold water, drink a glass of warm water, it will work wonders for your digestion. 2. Help lose weight. Hot water can be an excellent weight loss booster, combined with a healthy diet and a little light exercise. Hot water boosts body temperature, speeds up your metabolism and helps you burn calories faster. It also has a beneficial effect on your kidneys and all excretory organs. 3. Increases your metabolism. Drinking a glass of warm water in the morning will boost your metabolism and help your body function properly. It will also help you to eliminate the stomach pains that are usually caused by slow metabolic function and inadequate digestion. 4. Relieve pain. Many people find relief from drinking hot water when they have pain, especially in the case of menstrual cramps. The heat of the water will relax the muscles of the stomach and relieve the pain. But it can also be beneficial with other types of cramps, not just menstrual, as it improves hair circulation and relaxes muscles. 5. Improves circulation. We have already mentioned earlier that drinking hot water on an empty stomach can help you eliminate toxins and remove accumulated waste from your body. This, in turn, will speed up circulation and promote your overall health. 6. Delays the process of aging. We all want to be young and beautiful forever, and we try to do everything we can to preserve our youth and slow down the aging process as much as we can. Water can help you achieve this goal and prevent premature aging. When our body is flooded with toxins, this affects our overall appearance and makes us look a lot more. However, if we drink a glass of hot water every morning, our body will remove the toxins faster, slow down the aging process and improve the elasticity of our skin. 7. Reduces constipation. Consumption of hot water relieves bowel movements and relieves constipation. Drinking a glass of warm water on an empty stomach every morning improves bowel movements and also reduces the frequency of stomach problems such as bloating, gas and constipation. 8. Improves hair health. By activating and energizing the nerve endings of hair roots, hot water can make your hair soft and shiny. Activation of hair roots can also promote hair growth. In addition, warm water moisturizes the scalp and prevents dandruff. 9. Relieves cough. A natural cough suppressant is to drink a mixture of hot water and honey, which provides both relief and expectorants without a prescription. With fewer side effects, hot water is simply cheap and readily available compared to other medications. Mixing hot water with honey also provides relief from other respiratory infections. 10. Comfort arthritis. In order to get some relief from the pain and discomfort caused by arthritis, hot baths and swimming pools or hot water bottles should be considered. Hot water relaxes and relieves joint aches, cramps and muscle spasms. It also calms the nerves and muscles after exercise and improves blood circulation throughout the body.
Ayan. Yan, DJ Joseph, DJ Raymond. Diba? Cheap lang ang water. Kaya ang tao,
Very
if you
important.
are preventive, our body is composed of 70-75% fluid. So, mura lang naman ng tubig. Why
Yes.
why would you want a expensive solution when you can have a cheaper one, 'di ba? Yun.
Tama po. Tsaka the
Yeah.
best detox din sabi ng ibang
Madami
water
naman pwedeng gawin.
basically.
Yun nga lang kasi ang tubig walang lasa. Pero there are always ways naman to make the water
Actually,
more
masarap din po.
palatable.
Sarap na pag nasanay
Depende.
na. Just don't be, wag kasi
There are
yung taste buds natin kasi parang nasanay tayo.
acquired,
Sweet, acquired taste.
acquired
Yan.
taste. Oo.
Oo.
But anyway,
Yung water is good. Sige po. Yes, ma'am.
talking about
Our
water,
health.
meron akong health tip for the day. About water nga
Okay.
Sabi, di ba we were talking about yung volume ng urine. So,
Yes.
if you want, the first, which is my first one.
Ito
If
po.
you want to increase, if
ito
you
pala.
want
Sorry.
to
Want to
if you want
increase
to
your
increase your
urine?
urine volume, especially when you have urinary tract infection, you may drink buko juice. Di ba yung buko, maganda talaga
Yeah.
siya kasi yung buko has
How about
antibacterial,
coconut water?
yun na,
Opo.
buko juice. That's coconut water.
Yun na rin po.
Yeah.
Okay.
Yun nga lang,
Yung buko juice kasi sa
wag
young
lang
eh.
yung,
Di
pero
ba
wag
yung
lang
sa
yung
young?
may asukal. Dapat yung
Yes,
buko
yes.
na yung, di ba yung with the shell, na pitas, bagong pitas from the tree,
No water
gano'n.
and no sugar. Pure lang. Pure coconut water.
Oo.
Juice.
Pure coconut water. Or kung
Yeah.
gusto nila, di ba, para mas convenient, we have
With
also
coconut milk.
our Gusto veggie
Yeah,
juice.
gusto veggie juice
Oo.
for
But this
detox.
one is I have a Korean friend who told me that it makes them pee more. Yon, kaya they like the Gusto juice. Oo.
Yes,
And then
actually,
another
that's
thing
my experience din po sa gusto. That's also my
oh.
experience. Yeah, I
Kasi
also
nga
feel.
to prevent enlargement of the prostate, you have to
Yes.
clean, 'di ba? To clean your system, your
Yes.
fluid system. Ayun.
Hindi naman change oil. Not change oil. Ano lang muna. Clean lang. No need to
Clean
change
lang,
oil.
oo. Para parang tune up ng kotse.
Tune up.
So, i-tune up yung urinary system. And then another tip
Yeah.
also, which has something to do with water, because we know that water is always associated with our kidneys, di ba?
Yeah.
So, if you feel that you have a problem with your kidneys, na medyo feeling mo baka may bato ka, or sumasakit yung yung dito sa likuran, that is your kidneys yung the lower back. Normally, it has something to do with kidneys because most Filipinos, they eat very salty food and then you don't drink. So, if that way, mas nahihirapan yung kidney mo to work optimally. So, that's why you have those urinary tract infection problems. And worst of all is, you'll end up with having dialysis. So, and kidney is the only organ na hindi mo nga pwedeng The only way to correct kidney when it has not functioned is to kidney transplant ang kailangan, which is a very nakakatakot
Very
na
unthinkable,
process.
yeah, very
Kasi
unthinkable, no?
ano yan eh, oo, number 1, maghahanap ka ng donor, meron ba?
Naku,
Number
haba ng
2,
pila diyan. May makilala ko, grabe ang
oh,
pila diyan.
after yung dialysis
Naku,
pa, yung
yeah,
process,
maintenance, yeah. Naku
oh.
po,
Tapos
grabe
yung
yan.
ano pa, yung assuming nakahanap ka na ng donor, you have to be in isolation for at the minimum 6 months. Ganon. Madaming, very
Ang dami
complicated
po.
ang kidney eh. Oo.
Opo.
So, how do you take care of your kidney? When you feel your kidneys are a little compromised for the day. Kaya for example, feeling mo, ay parang may bato yung kidney ko. May bato sa bato. No? May
Nahirapan ka kang
bato.
ihi.
Nahirapan kang umihi. You can take
Okay.
distilled water for a
Okay.
few days. It helps clean the
Okay.
kidneys. Oo. So,
Okay.
hindi naman natin sinasabi na forever kang mag-distilled water kasi that is also not good. If forever,
Yeah.
wala ka ng minerals na nakukuha. Kasi nga pag
Yes.
mineral water, may minerals eh. So there's a
Opo.
tendency for you to have stones. But
Pero
we're not saying,
opo. Pero yung mga
pero
water ngayon, ano na, karamihan, yung purified, parang distilled na rin. Halos wala na ata itong,
hindi.
sa
No,
mga
it's
water
different.
station. Meron pa rin
Purified
po.
is
Okay.
not distilled. Iba yun eh.
So,
Ang
bakit iba yung distilled?
purified,
Pinakuluan talaga yung distilled eh. Di
ano
ba?
yun eh, yan yung vapor. You catch the vapors of the
Yun
water.
yung, same with lambanog eh.
Oh.
Yung dinidistill.
Ibang ano
Yung
yun.
patak na ibang distillation yun ha. It's not good for your kidney.
It's not good for your
Okay.
kidney, but it underwent the distillation
That's
process.
right.
Ayan. Oo.
Okay.
So, ayan. So, we hope to see you all next week.
Yes,
And,
we have to wrap up our the month, the fire prevention month. We have a firewoman, firewoman, sorry, firefighter, female firefighter. Tama-tama, patapos na rin yung International Women's Month. Yung mga health hazards, kasi di ba, di lang to life threatening. Sometimes the unthinkable happens also, di ba? One of the worst things that can happen is to have a house fire, no? Or have a fire break out in your place, office, or house. So, or neighborhood pa lang dito sa amin. Last, mga December yata, nagkaroon sa kabilang compound. Pero we all got scared. Siyempre, iba yung fire. So, yan, pag-uusapan yan.
Yeah, just recently nga, 'di ba, may fire nga diyan sa Corinthian, no? Madaming namatay, 'di ba? So, it's very good that we have a firefighter who will talk about how to prevent fires.
Yes.
Kung minsan
Kaya mga hazards yan sa health natin. And also mga basic steps on how to prevent it.
Yes, oo. Ganyan pa rin tayo. Sa prevention pa rin tayo. So, kahit nag-fire, pine-prevent pa rin natin. Fire sa bahay. So, thank you very much, DJ Raymond. See you again next week. Bye-bye.
Yes. All right. God bless.